My message and my plea will always be about testing and test numbers in New South Wales. I'm urging again New South Wales to come out and be tested. As you've seen over the last few days, there are some level of concern in some of our cases. Last night there was 26,112 tests, so thank you for coming out, but that number still is on the low side. We did hit the 30,000 mark a couple of days ago, and I'm encouraging New South Wales to keep coming out and get tested. It is very important that we do so. I've spoken about it consistently, about how important it is in relation for governments to make decisions. And today, my plea again at the end of this week, to continue the testing over the weekend, to continue to get tested, regardless of the symptoms, mild or not. If you've been tested before but you're not sure, please come out and get tested. And I will continue to say that message. Out of the 26,112 tests last night, there were 11 cases. Out of the 11, 7 were overseas acquired and 4 were locally acquired. 2 were close contacts of the Barilaro cluster, 1 a close contact of the Croydon cluster, and the final one was in relation to the individual that we spoke about yesterday connected to the Avalon cluster. So recapping, 11 cases overnight up to 8 p.m. last night, 7 overseas and 4 locally acquired. Of course, the breaking news this morning is Queensland going into Brisbane going into lockdown. And what does that mean for New South Wales? Of course, our health officials have been working with our Queensland counterparts to understand exactly what has occurred with the breach in quarantine, the actual strain itself, and what we can do. Now, I'm sure today there'll be people calling on New South Wales to close its border to Queensland. Now, at no point during this pandemic have we ever had a knee-jerk reaction or have treated the border like a light switch. You know, what we do is work with our counterpart, offer support, because whatever happens in Queensland impacts what happens in New South Wales or any other state. And you know, we are all working together for the benefit of Australians and citizens of this nation. But in line with that, can I say, 6 p.m. tonight, and I will read the areas, Queensland will go into lockdown for areas of Brisbane, Logan, Ipswich, Moreton and Redlands, and that's over 6 p.m. tonight. But from a New South Wales perspective, by the end of this press conference this morning, by lunchtime, what we will be saying is clear, that if you are in the midst of travelling from Brisbane as we speak into New South Wales and you come from those areas, we expect you to abide by the isolation rules that would have applied to you if you were in Brisbane. If you visited Brisbane and you're on your way to New South Wales, again, those isolation rules will apply to you. Now, if you are already in New South Wales and you've travelled to New South Wales from those locations, there is a sense of retrospectivity here, since, of course, 12:01 a.m. on the 2nd of January, we expect you to again stay isolated. Now, I will get Dr. Kerry Chant to elaborate further on that, but it is very, very important to understand that we won't be locking down the border, but we are going to be applying the same level of restrictions to those that are either coming or are here in New South Wales that have come from those areas. We also must, I want to announce today that we have now put in place the same safeguards that we had for the test match in relation to mask wearing and all those other safeguards will now apply to the A-League for the rest of the month to assure the people of Newcastle with the game that's going to occur in Newcastle, but for all those major sporting events with the A-League this month, the same safeguards that we've got in place for the tests that we saw commence yesterday will now apply to everybody in that space. I'll also, again, want to stress that while test numbers are low, it still gives us some level of confidence in relation to what is occurring in this state. And I'm just urging people to please work with the government. The more we do together, the more that we are confident in decision making. I will also refer back to Minister Hazzard to talk about the Northern Zone restrictions and the Northern Beaches in relation to those restrictions shortly. So with that, again, I'm urging everybody to just do the right thing, especially if you are visiting from Brisbane, if you are already in this state, if you're captured by the retrospectivity that we're saying that goes back to the 2nd of January and you are in this state, or if you're in midst of travel, I urge you again to do the right thing and follow the rules. That is how we've beat and been able to stay in front of this COVID plan. Now, for those that will be flying in, the same sort of arrangements at airports as we had for South Australia, where we'll be asking people as they come off those flights for their information, because if something does occur, it is going to be very important that we'll be able to respond quickly in relation to that. If you are driving over the border, there isn't going to be some border closure, as I've indicated, but please try and document exactly your travel itinerary so that if, in case something occurs and we get in touch, that you are able to accurately give us your itinerary to help us minimise any impacts going forward. Again, I urge the public here in New South Wales to do the right thing, follow the rules and work with the government and our health officials. With that, I'll ask Dr Kerry Chant to elaborate on those issues this morning, and after that go to Minister Brad Hazzard. Thank you.
Thank you, Acting Premier. So New South Wales recorded 4 new locally acquired cases of COVID in the 24 hours to 8 p.m. last night, and there were 7 new cases acquired overseas, bringing the total to 4,806. So of the 4 locally acquired cases, we had 2 cases linked to the Barilaro cluster, a woman in her 50s and a teenage boy, both household contacts of previously reported cases, and pleasingly the cases were in isolation for their full infectious period. An additional case was linked to the Croydon cluster, a child who's a close contact of a previously reported case, and again they were isolating for the full infectious period. 1 case remains under investigation, and that's a gentleman in his 40s from the northern zone of the Northern Beaches who was mentioned at yesterday's press conference, and I'll go into a bit more detail a bit later. So there were 26,112 tests reported to 8 p.m. last night. So can I echo the Acting Premier's call for testing? It's really pleasing to see those high rates of testing, and I want to acknowledge the work of the people in Barilaro and the surrounding suburbs for coming out. But we need to continue to come out, and that broader Western and Southwestern Sydney, it is critical we have those high rates of testing, as well as the northern zone of the Northern Beaches, just to give us that assurance we're not missing unrecognised chains of transmission. So investigations continue into the infection source of a man in his 40s who tested positive for COVID several days after completing 14-day period of isolation. So the man was well and asymptomatic through his isolation and tested negative on 3 occasions during his isolation period. We have tested everyone around the gentleman and haven't managed to find a source. We are still having a couple of test results pending on some more casual contacts, and we have issued some additional guidance in relation to some venue information. So we've released new information on venues of concerns in Wentworthville and Avalon. So if you were in the Wentworthville ChemSave day and night pharmacy on Station Street on Sunday the 3rd of January between 10:40 and 10:50 or 9:30 and 9:40 p.m, you need to get tested immediately and isolate until you receive a negative result. And then remember, always, if you get symptoms appear at a later stage, get tested. If you're at the following venues in Avalon, please get immediately tested and isolate until you have a negative result. The Chemist Warehouse on Barrenjoey Road on Sunday the 3rd of January from 1 to 1:15 p.m. And we have a number of days and times for the Avalon Woolworths on Barrenjoey Road. So Thursday the 31st of December between 2:20 and 2:45, Saturday the 2nd of January between 3:45 and 4:05 p.m, Sunday the 3rd of January from 12:45 to 1 p.m, Monday the 4th of January from 6:30 to 6:50 p.m, Tuesday the 5th of January from 4:45 to 5 p.m, and Wednesday the 6th of January from 12:45 to 1 p.m. So anyone at those times and places in particular, the most minimal of symptoms, please come forward to get tested. It is essential for us to understand that we have efficiently got rid of any virus transmission that may be ongoing in the northern zone of the Northern Beaches. Want to also alert the community to a sewage detection, where we've got a positive sewage detection in the treatment plant at Ulladulla for the first time. The catchment serves a population of about 32,000 people and takes sewage from Narrawali, Milton, Mollybook Beach, Ulladulla, Kings Point, Burrell Lake and Dolphin Point and Lake Tambaroo. There have been no recently locally acquired cases or returned travellers who tested positive from this area. Now, obviously, this is a time of year where we have lots of mobility, so we can't exclude that someone who has cleared the infection from either New South Wales, Victoria, or a returned traveller from interstate may have visited that area. But we do need the community to respond, and also if anyone has been recently in that area, please also come out for testing. So regardless of where you've been, if you've been in that area in the last week, or live in that area or work in those areas, please come forward and get tested. There are a number of testing clinics in Ulladulla, and please refer to our website. I also want to give a bit of an update in relation to the UK and South African variants. So just to explain that New South Wales has two elements for its quarantine hotels. One are run by New South Wales Police with the support from New South Wales Health, and then we have a separate special health accommodation. That special health accommodation has positive cases, so when cases become positive in the police quarantine facilities, they are transferred to the SHA. Complex patients or patients that are considered at high risk are also managed in the SHA. And we also use the SHA to assist in isolating contacts where they may not be able to isolate effectively at home. So all travellers who are positive, just to reiterate, do go to the SHA and remain there until they're assessed as no longer infectious. Tests taken on returned travellers in hotel quarantine in New South Wales indicate that since the 30th of November, 6 have tested positive for new COVID variant identified in the UK. And in addition, preliminary tests identified a group of 4 travellers. This was preliminary test arriving last night, identified a group of 4 travellers in the SHA who are positive for the new COVID variant identified in South Africa. But further testing is underway to confirm these results. But as a precaution, the 16 people that were accompanying on that flight, the same flight, have as a precaution moved to the SHA, and that's because there are concerns that the South African strain does share the similar mutation from the UK that may be associated with increased transmissibility, and so that's why we're taking a very cautious approach there. So the remaining 2 cases with the UK strain and 4 cases with a possible South African strain are currently receiving care in the SHA and will be cleared to leave after they're clinically assessed as no longer infectious. And the remaining 4 cases with the UK strain were successfully managed in the SHA and discharged after being clinically assessed as no longer infectious. The other update I'd like to just give is to reinforce the message that the Acting Premier gave in relation to the message for people that may have left and departed the areas in Brisbane, Logan, Ipswich, Moreton and Redlands. So Queensland have taken action to announce that they'll have a stay-at-home order from 6 p.m. for those applying in Queensland. What we've immediately put in place is that anyone who has departed, left, worked or been in those areas from the 2nd of January and have subsequently come into New South Wales are obliged to self-isolate or basically have the same application of the stay-at-home orders. So that means that they can only do essential tasks such as going out for exercise, but they need to wear a mask and they need to keep away from others. They obviously have to attend essential health care and do other essential things. We're asking for any individual who's been in that area to not go to aged care facilities. So just to be clear, we will be advising the aged care sector to also screen anyone who may have been in that area. It is critical that we protect our aged care, so this is part of our usual response, that when we have any evidence of concern, we immediately advise the aged care sector to prevent visitors to the most vulnerable in our community. Thank you.
Thanks, Kerry. Obviously, the people of the Northern Beaches have had a challenging time in the last few weeks, and those in the northern end of the Northern Beaches remain in lockdown. Clearly, we were hoping that there would be no reservations about opening up the northern end of the Northern Beaches. But of course, the case of the gentleman in his 40s yesterday returning a positive case has caused public health officials a degree of anxiety, a degree of concern. But the view has been taken on the basis of the response that we saw, particularly before Christmas, from Northern Beaches residents in their willingness and capacity to come out and get tested in enormous numbers. Public health has confidence, sufficient confidence, that if we can expect a similar response from the Northern Beaches, then we can, with confidence and reservations, confidence and some reservations, enable the opening up of that community as from just after midnight on Saturday night. So at 12:01am on the 9th of January, Sunday the 9th of January, the people of the Northern Beaches will become part of the Greater Sydney circumstances and have the same rules applying to that area as applies to the rest of Sydney. As a Northern Beaches resident, I just want to really emphasise that the big issue for the public health officials was and is that the gentleman who returned the positive case yesterday had previously shown negative results. So it is concerning. Perhaps, there's no clarity around this, perhaps he has had a second infection of the virus. That's possible. But it's really the unknown that's worrying. It could be an indicator of unknown a chain of transmission or chains of transmission still circulating in the far end of the Northern Beaches. So can I say to all of our friends on the end of the northern end of the peninsula, on the Northern Beaches, yes, we're back to as normal as we can be in a COVID environment here in Greater Sydney as of just after midnight on Saturday. But please, please come out and get tested. We need to know, for your sake, for all of our sakes, for the people of Sydney and New South Wales and indeed Australia, that we don't have any more cases still circulating that we're not aware of. I also want to address the issue of mask wearing, as the Acting Premier has indicated. Obviously, there are health orders in place that require masks to be worn at the SCG, and I want to thank the vast majority of people who are attending the SCG who wore their masks willingly, unreservedly, and did their bit to keep everybody else safe, including themselves safe. And the same order is now applicable to the A-League games in the next few weeks. Of course, as the Acting Premier said, there'll be a game tonight in Newcastle. Just ask people to really make sure they do wear those masks. It is the fourth layer of defence. As Dr. Chant has told us many times, we should never forget the basic rules while we live in this world that has COVID circulating so rampantly in other parts, and that is maintain your 1.5 metre social distancing. Any symptoms of cold or flu, go and get tested immediately, and don't forget the importance of hand hygiene. Wash your hands or clean your hands like there's no tomorrow. But wear the mask. There may be some who would think that having a glass of something in your hand is acceptable as a way to avoid wearing the mask. The only person you're dudding is yourself, and of course you're also dudding the community if you don't stick with the rules of wearing a mask when you can do so. In other words, the only time you shouldn't be wearing a mask is if you're eating or drinking, and that shouldn't be all day. It should be the whole time you're there. Just do it sensibly and carefully, and do what everybody else in New South Wales has been doing, and that is making sure that as a state, as a community, we have addressed and will continue to address this COVID situation as well as anywhere in the world. Thank you. Questions? Sorry. Look, it's too early to make any of those sorts of pronouncements. What I would say is that public health officials have worked very closely with the Queensland public health officials and are working through just how we respond to what has happened in Brisbane. But You know, this is, as the acting Premier has said, as the Premier has said, as I've said, as Dr. Chant has said, you have to expect that from time to time we will have outbreaks of this virus. To expect that in a worldwide environment of a massive pandemic, with people coming in, our Aussies coming back from overseas largely, and freight coming in, there will be from time to time some issues. But we'll manage it. We'll manage it carefully as long as everybody stays on the journey with us. Sorry, yeah. Okay. No. Look, this strain is obviously a challenge, but getting variations to a virus, getting variations, mutations to a virus is not unusual. That's what happens. That's the reality of viruses. There are many viruses circulating through our community that in past times, SARS, MERS and so on, that were major issues for parts of the world. It's not unexpected, but of course from time to time a variation can occur that presents increased risk. Other times it can present decreased risks. This is a step that the Queensland Government have taken. They feel is necessary because of obviously this particular variant to the virus, and we are happy to ensure that the rules they're putting in place for Queenslanders will apply to Queenslanders and others who visited Brisbane in the last few days since the 2nd of January. I think it's entirely appropriate. We have to have a measured and sensible response. And I think New South Wales, under the guidance of Dr. Chant and her public health team, has always had a measured and sensible response. And we will continue to do that. Chris, sorry. Chris, sorry. I missed the first part. Chris, say it again.
The numbers of the Sydney test are well below, anyway, what was expected. Why not just say, look, no crowd?
The government has made a decision in consultation with Cricket Australia and obviously SCG and Public Health, and those people who attended it I'm sure are enjoying every minute of it, and it does provide a sense of normalcy. And as I've said many times in the last now nearly a year, we are absolutely determined to have a sense of normalcy in our community. Charles.
From Brisbane in the next 7 or 8 hours, how confident are you they'll abide by the request that you've made that they isolate themselves? And what are the risks if they don't?
I think everybody who is coming from or may come from Queensland, but first of all I'd say this, if you don't have to come from Brisbane, don't come in the next few days. Comply with your government's requirements. If you're a resident in Brisbane, don't come if you don't need to. If you really need to, then comply with the requirements that your government has placed on you in Brisbane, but comply with them here in New South Wales. And we will be backing that in. I mean, essentially we want people to just be on the journey with us, but there will also be orders backing that in, and there will be fines available to be enforced if people breach those orders.
Queensland's response to this one case tied to this mutant strain of the virus was warranted?
Look, I think that it doesn't behove us to impose on other states our views on anything in particular. I think that we work with what other states and territories do. We've been very careful here in New South Wales not to either be critical or to make any negative comments about other states' governments trying to manage this issue. This is a virus with no playbook, and as each government does their best, given the advice of their public health teams, I think we should back them in, and that's what we're doing. Sorry, can I just finish with this and then I'll come to you? Yep.
There's no repercussions for New South Wales, I guess, in the sense of,
And that's why we're taking the steps we're taking. Sorry.
For the Deputy Premier. But we're now seeing regional agricultural shows cancelled and regional community events go under because the Greater Sydney restrictions are impacting the whole state. Why is Wollongong still grouped with Greater Sydney, and what will it take to have it removed from those levels of restriction?
Well, firstly, Greater Wollongong, Central Coast, the Blue Mountains, has always been classified as the Greater Metropolitan Sydney, and that was to deal with the mobility of individuals that had travelled into the Wollongong-Illawarra area. And only a couple of days ago we had indicated that there was a case connected to a close contact down there. These decisions are made not based on agricultural shows or zones or where you live. It's actually made in relation to public health. And what we have put in place is orders and safeguards to protect this community where we believe there is greatest risk. Regional Rural New South Wales, at this stage, continues to have lesser restrictions because of the lesser risk and the lower risk. But just like we did the other day, in relation to that young gentleman, the 18-year-old from the Barilaro cluster who travelled through the Central West, that we then asked that those communities to come out and be tested. And thankfully, we have not had a positive result, and therefore it allows us to continue on with what happens in the bush. Now, in the regions, communities will make their own decisions in relation to shows, but right now, under the rules, those shows will continue. I'm not going to start a fight between Wollongong and the Illawarra versus regional or rural New South Wales in relation to classification. This is about the public health and keeping the public safe. That is what our decisions have been made on.
Can I ask, you mentioned before about local strains from the UK and also South Africa. We have had a number of breaches from hotel quarantine with security, cleaners, transport workers and COVID getting out into the community from that. Have we had any breaches from the health accommodation as opposed to the hotel accommodation? And what differences are there? Are there extra precautions at the health accommodation?
So in relation to the health accommodation, so the distinction is that we have the police-managed hotels and there's clearly a health presence at those police-managed hotels. We arrange swabbing and other services for those residents in quarantine. The more complex patients and positive patients go into the health hotel. That is staffed by nursing staff, and obviously there is security and police, but it has a higher, it's probably almost like a variation of a hospital setting. So that's probably the distinction. We're seeing increasingly quite complex health needs emerge in returning travellers, which was very different from the pattern we were seeing early on. And so the health hotel is essential in managing both COVID, but also very many other underlying health risks.
So that distinction sounds more like it's there to help the patients better care, but is there any extra security given that they are carrying these quite severe strains?
So all of the health staff within the facility are health staff that are very familiar with wearing PPE. There's strong, incredibly strong auditing processes, as there is across the police hotels. So, but it is stronger. Clearly, people know that there is a higher infection burden and higher risk. We've got that commensurate increase, but I think we're moving into a time where we actually have to see every person who's travelled from overseas as infectious and treat them along their whole end-to-end journey. But certainly we have quite rigorous processes in the health hotel, and also quite strong assessment before we're releasing any any people that have had COVID into the community. Just to describe some of the additional barriers and things we're putting in place, we've certainly doing the surveillance testing, and surveillance testing around the staff have been in place for quite a significant time in relation to the Sydney health accommodation, and that's been progressively rolled out across police hotels as our capacity to do that has increased. There hasn't been, to my mind, any transmission breaches, but what's important is we also have quite a high vigilance when there's any near misses. So you need a real reporting culture. I think we know that we work and live in a very human system, and there's always a risk that someone inadvertently forgets to take a mask off or just touches their face. And partly it is about that vigilance and making sure that we all are very much a team, and whenever there is a problem, that we then respond to it. So clearly, if I told you that there'd be no issues, that there'd be no events, that would actually say the system's not working, because it is a human system. So there's been occasions where there's been minor transgressions or minor things that people have observed, and then there's been a comprehensive response, which to my knowledge has not led to any transmission. But we need to contain that. As these strains associated with variations in the genetic structure that might impact their increased transmissibility, it does give us cause for concern, and we have been re-looking at everything we've been doing to see what additional precautions we need to do, and I've discussed some of those over the preceding days.
The Minister sounded decidedly uncertain about it. How big a risk is it in your mind? And have we ruled out the prospect that this gentleman, that this is an infection from the first one, second infection?
So the Northern Beaches community have come out with stellar testing levels right in the early response, and they've continued to do so. I suppose just to back in what the Minister said, I'm just urging that we do that last push for the community. If you have woken up this morning and you have the minor headache, sore throat, scratchy, itchy throat, you think, you wait for a few hours, can I just suggest you don't? Go down there, get a test. Obviously, we're considering multiple scenarios to explain why this gentleman got it, but at the moment there is no clear-cut answer, and we have to take seriously the risk that this person has been inadvertently exposed in the shopping centre or his other limited exposure venues. We are doing more testing, so that is why the community, the best thing the community can do is just come out in force to give us those testing numbers, which will give us that added assurance that we're not missing significant community transmission in that Northern Beaches.
Kerry, also, can I just say something there? It was pointed out to me that perhaps I'm a little too tired. I got my dates wrong. It is definitely Sunday at 12:01am, but I said the 9th, that's the 10th. So my apologies to anybody out there on the Northern Beaches who are trying to work that out. Perhaps it's just a little too long working hours at the moment. Sorry, Dr. Chan.
About the Northern Beaches. Question for you about the Northern Beaches. So obviously they'd be very relieved to be coming out of lockdown on Sunday. We did hear from the government mention about a relief package for people living in that area. When can we expect further detail about that? Obviously there's been businesses that have been suffering as a result, and will that be extended beyond restaurants and hospitality venues?
Okay, so firstly, can I again reconfirm that as of midnight tomorrow night, which is Saturday night, which makes it 12:01 Sunday morning, but as of midnight tomorrow night, those restrictions will be lifted for the northern zone of the Northern Beaches, and they will come into line with the rest of the restrictions that we have for Metro Sydney. In relation to support, we heard, I think it was yesterday, that the Treasurer, and along with the Small Business Minister, had indicated one of the areas that we want to see, that we want to stimulate initially is through the hospitality and tourism sector, and that is through, of course, our Dine and Discover cards or vouchers that we are going to fast track and be part of the pilot and include the Northern Beaches. When you think about that fund, there's $500 million set aside in this year's budget to get people out and about. If we can get people out and about into the beaches, supporting local businesses, that'd be the greatest stimulant those businesses would love to see. If there are other measures required in relation to supporting businesses and other businesses outside of tourism and hospitality, again, as I indicated yesterday, the Treasurer, the State Treasurer, Dominic Perrottet, along with his federal counterpart, and Josh Frydenberg, along with the local members, I should say, like Brad Hazzard and James Griffin and Rob Stokes, who have been working with their chambers and their community, will work through those measures. And what we'll always leave on the table is the opportunity to look after sectors that may be disproportionately impacted by a lockdown. But at this stage, by having a stimulus into that community off the back of what was already announced out of the budget, the Dine and Discover package, I think it's a great start to try and support those businesses.
We've got some glorious weather coming for Sydney, and we know what that means on Northern Beaches. You want people out and about? Are you concerned about that they will take that to a licence to flock to the beaches and so on?
Well, firstly, I've stood in front of you all week in my acting role in the hot seat, and one of the things that I've learnt this week is the work that happens behind closed doors. The advice that I have received all week isn't just advice that is worked up half an hour before a press conference. It's the work of our health experts led by Dr. Kerry Chant. And that advice has led this government for the past 10 to 11 months to make decisions in relation to managing the COVID pandemic at the start and now, of course, reopening the economy. And what I've been confident about is that we have remained sensible in that advice, and we've taken that advice seriously. But we've also had to find a balance between opening up the economy. Is there risk in opening up the restrictions on the Northern Beaches? Of course there is. There are risks each and every day. Each and every day as we coexist and live with this pandemic. And Minister Hazzard touched on it earlier, that there are always going to be some level of outbreaks. There is always going to be a chance that things may go astray. But just like we did over Christmas, when the Avalon cluster appeared, a lockdown appeared, what we've always said is so that we can find a balance with restrictions, we would respond fast, hard and local. And that's what we did on the beaches. So am I confident that we can open up the beaches this weekend and hopefully this glorious weather and people will be out and about, because I believe that's important for the mental health and well-being of that community. And people that have been in lockdown for such a long period of time, in many cases on their own, well, I'm balancing that against the risk that the advice that I have received. But like always, we'll take that advice day by day. But as of tomorrow, midnight, those restrictions will be lifted on the northern beaches, and I look forward to that community coming back to some level of normality.
UK strain. There's some reporting out of Britain today that the so-called super strain may not be as much a super strain as a natural uptick in cases for a population that's highly indoors at Christmas time in particular. Have you of your colleagues done independent studies on this strain, and how much more infectious is it if it is in fact a super strain of sorts?
So the best minds around the world are looking at the information that's coming out everywhere, and I think that probably a few weeks ago the AHPCC put out a statement which was a bit like we're sitting on the fence, we just need more information. I think that there's probably been a little bit of shifting consensus expert advice to say that it looks like there is something real about its increased transmissibility, but many more studies need to be done. We know that basically there's a combination of factors that lead to transmission. We know that being indoors is the highest risk. When you put people together in density, we don't have the controls, people are mixing. This is a recipe for COVID transmission. Poorly ventilated spaces, indoors, even within households I've mentioned before, are really critical. So obviously those things need to be teased out. But as you'd expect, the world needs to take a very precautionary approach. But the best advice I've got is that we do believe, there's a number of experts that believe that there is increased transmissibility associated with that particular mutation. I think we need to take a cautionary approach, and that's why we're also taking a cautionary approach. I would like to say that one of the challenges of just targeting one particular country or UK strain is that we are a world. International travellers go everywhere, and I think we've learnt that in COVID, that you can't block a particular group and a particular time, and you've also got to watch out because there will be mutations arising everywhere. So I'm really pleased to say that we've got great genomics expertise in New South Wales. We are sequencing the virus whenever we get it from our overseas travellers, so they test positive, they routinely get tested, and that testing is quite timely. Those laboratory virologists are amongst the best in the world experts, and they will alert public health and the clinical teams to anything that may have significance, because either it might influence the way the patient is managed or have public health implications. And so that really working hand in glove with those experts is a critical factor in our response.
Thank you. Yeah, can I just get one more? Just in regards to so much of the strategy now revolves around people's postcodes and what it says on their licence. Yesterday at the SCG, certain suburbs weren't allowed. Today from Queensland, certain suburbs aren't allowed in, or they have to do their isolation. Are you concerned that people might not have their actual address on their licence? Plenty of people move locations and might not update their licence.
Is it foolproof? Well, nothing that we've probably done is completely 100% foolproof. And the truth is we rely on people to do the right things. And we've seen great examples of communities coming forward when we've asked them in the regions, on the northern beaches, now in Baralla and Western Sydney, down in the Shire, in the Illawarra. So whenever we ask the community to do the right thing, what we're seeing at the cricket, people keeping masks on transport, this is not government versus the community. This is a combination of everyone working together for the benefit of everybody, for yourself, your family, your loved ones, and of course the broader community. And what we've been able to do in a way, and the approach that we've been applying since the Avalon cluster has been this local, fast and hard approach, which we're now seeing is occurring in Brisbane, may become the norm, but that norm must rely on trust. Look, at the end of the day, if someone wants to do the wrong thing, trust me, with the CCTV cameras we've got about, with the data that we collect, trust me, we'll be able to find you. What we've also found as a surprise, people will actually dob you in. We've actually found that as a surprise, that because people don't want to live with fear and anxiety in 2021, They know that we're going to continue to live with this virus throughout this year. But have we learnt anything from last year? Yes, we have. And that is that we can live with it if people are honest and do the right thing. And that is my message to everybody in New South Wales. Together, we will get through 2021. Thank you. Everybody.